Hi, Mark Sweeney here from Austin Dental Spa in Austin, Texas. Let's talk about lasers in dentistry. Well, I get a lot of questions about that. I was an early adopter with the lasers. Back when they first came out, there were only diode lasers. So let's talk a little bit about what a laser is. A laser is light amplified. It is light energy that's been harnessed and intensified so that it can actually cut tissue, hard or soft. The diode lasers that were first out in dentistry 20 years ago would only cut soft tissue. But the advantage was they would cut soft tissue much nicer than a scalpel does, where a scalpel is actually causing some damage as it cuts through the cells. A laser ablates the cell. One of the lasers we have is a water laser, and it actually seeks out water containing tissue and it ablates or explodes it, for lack of a better term. But that is a much nicer way, as far as the body is concerned, to heal from. So there's no burning really involved. That would be misuse of the laser. But if it's used correctly, it will take tissue away with no bleeding, with a very fast healing time, and almost no pain. One of the main uses of a diode laser is to take excess tissue away. If we're giving somebody a new smile and one tooth has a higher gum line than the other, and we decide between me and the patient that we want to raise the shorter tooth, raise the gum tissue on it rather than lower the gum tissue on the longer tooth, it's very simply accomplished with the diode laser with a little bit of numbing gel, no injection. Most of the time it takes about 10 minutes. And there's no pain afterwards, there's no bleeding, it heals very rapidly. So that's one of the main uses of a diode laser. The other, my hygienists use a diode laser because it also will sterilize tissue. So when they've done a deep cleaning on someone that had been a long time since they've had a cleaning, they had a lot of bacteria in the little pockets around their teeth and some bleeding there. Once we've cleaned the teeth, we've set the diode laser on sterile mode and go around each tooth, and it kills any bacteria that are remaining in there, sterilizes that pocket briefly, and speeds up healing. The light energy from a laser penetrating into healthy tissue will speed up healing. The other use of lasers is for hard tissue. That requires an erbium laser or a CO2 laser. We have an erbium laser here in the office, and it will take tooth structure away because tooth structure does contain water, but not as much as gum tissue. Why would you use an erbium laser instead of a drill? Well, there are times, especially down along the gum lines of the tooth, where a laser is going to be just as fast as a drill. But in general, you can figure that the laser is it has two distinct disadvantages. A laser is going to be slower than a drill, taking tooth structure away, healthy or diseased tooth structure. And it's also not going to leave a smooth edge. Whereas a drill, you can get a very precise, fine edge. A laser leaves kind of a rough surface. And so a lot of times these commercials on TV about laser dentistry are a little misleading because you still have to use a drill to smooth the edges up before you put a filling in. And we're getting better week by week, year by year with lasers in dentistry. There's a new one out, a Solea laser, that is on my wish list that I'll have before I finish my career. But it's I've learned, let somebody else be the first one on the block to get it, and let them work out all the kinks in it before we buy one.